Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a 4-year-old male patient who is presented to care by his new adoptive parents. The patient has been in a variety of foster homes since birth, but is now finally in a stable adoptive home. The adoptive mother is concerned that he might have attention deficit hyperactivity disorder because he literally cannot sit still. He is constantly moving and seems to shift attention from one thing to another without an ability to spend any meaningful time on one task, even if he is enjoying it. On physical examination, the NP notes that the patient has short palpebral fissures, a thin upper lip, and a long, smooth philtrum. Suspecting a diagnosis of fetal alcohol syndrome, the NP expects to find which additional physical findings? A, underdeveloped ears, B, bradycardia, C, polydactyl, or D, macrocephaly. So this really is an assessment question, very specifically a physical examination question, but it also presents an important point for consideration in your clinical practice in that remember when you see a patient, for especially a new patient, but I suppose with any patient encounter, don't fall very quickly into that real narrow tunnel vision approach of just evaluating for specifically what the patient, or in this case, the patient's parent thinks is going on. In other words, the adoptive mother is here because she thinks the patient might have attention deficit hyperactivity disorder. And in that case, it would be very easy to find yourself just very specifically doing an evaluation for ADHD, which, as you know, will encompass a variety of assessment questions to determine whether or not the patient has 6 or more findings consistent with DSM-5 TR criteria. And while that certainly should be part of your evaluation, you don't want it to become the whole thing. You don't want ADD to be the only focus. It's really one of the most common mistakes that not only new clinicians make, but even experienced clinicians across the board. It's really easy to fall into that tunnel vision thing. Remember that your first encounter with the patient, the new patient, the original chief complaint, that's your time to be very broad in your assessment, be very broad in the formation of the differential diagnoses. So even if evaluate for ADD or ADHD is the chief complaint, you're still expected to do a comprehensive assessment and a physical examination. And in this circumstance, it is really important that the NP notes that the patient has short palpebral fissures, a thin upper lip, and a long, smooth philtrum, because that is the classic physical triad of fetal alcohol syndrome. Definitely not the only findings. There's a number of other both physical findings and subjective symptoms that may be reported, but that classic triad of fetal alcohol syndrome is something we should always be open to evaluating and recognizing as being there in any new child patient. Now, as it happens, fetal alcohol syndrome can also present with a number of neurocognitive impairments, including ADD or ADHD. In other words, when you see a patient with fetal alcohol syndrome, you know that the likelihood that they have an underlying attention deficit or deficit hyperactivity disorder is actually increased. But the real point here, the point of the question is to test your understanding that a patient with a short palpebral fissures, thin upper lip, and long, smooth philtrum, you do need to be able to recognize that that is the classic triad of fetal alcohol syndrome. And then once you recognize that the patient has fetal alcohol syndrome, you can look for any other number of findings that may be associated with it. In this case, the additional physical findings, that's what it's asking you. Suspecting a diagnosis of fetal alcohol syndrome, the NP expects to find which additional physical findings. And A is the correct answer. Underdeveloped ears is also very classic of FAS. It may present as low-set ears or an underdeveloped superior aspect of ears, but underdeveloped ears is a common finding. Cardiac anomalies may occur with fetal alcohol syndrome, but bradycardia is not distinctly associated with it. Similarly, while abnormalities of the digits may occur, such as curved or bent fingers, not unusual to see that the fifth digit sometimes is curved or bent. Polydactyl, an extra digit, is not typical. And while microcephaly may occur with fetal alcohol syndrome, macrocephaly is not classically associated. So again, the real takeaway from this question is suspecting a diagnosis of fetal alcohol syndrome, which additional finding might you expect? And the answer is underdeveloped ears. So for your certification exam, the takeaway here is to recognize that short palpebral fissures, which is that distance between the inner aspect of the eye and the lateral aspect, the inner canthus and the outer canthus, that it's short. Thin upper lip, and then a long, smooth philtrum. The philtrum is that area, like at the center of your upper lip where there's an indentation, and then, like laterally at the center of the upper lip, there's like those two lines. You often see that like smoothed out in fetal alcohol syndrome. So, like I said, the takeaways are recognizing the triad of FAS and that there's a variety of other things you may find, including underdeveloped ears and an increased tendency of ADD or ADHD. And for your clinical practice, just keep in mind that we always want to be broad-based in our initial assessment because we will often find things that the patient or the patient's parents didn't even suspect might be there.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.